following up on this Minnesota news, given the fact that this individual began experiencing symptoms on November 22nd, tested positive on November 24th, that would suggest that there's been community spread of this variant for at least the last 10 days within the United States. Is that the White House's assessment, and to what extent does that change your understanding and your approach to combating this new variant?
Well, I think we need to be very careful from the government and of course from the media as well about how we assess and attribute community spread or what has happened here. There was information put out by the Minnesota Public Health Department. I would just reiterate a couple of the components of that. Many of you may have seen it, but in case you haven't, there's an individual, an adult male, a resident of Hennepin County. He had been vaccinated. The person developed mild symptoms, as you noted, on November 22nd and sought COVID-19 testing on November 24th. The person's symptoms have resolved. The person spoke with the Minnesota Public Health Department investigators and reported traveling to New York City and attending the Anime New York City 2021 convention at the Javits Center from the 19th through the 21st. Any contact tracing, which is imperative and important, would be done through the CDC and public health officials as well. But I would also note that the Minnesota Public Health Department will do a press conference at noon, and we would expect they'd have additional information. Important question about contact tracing and what we anticipate. I just want to really rely on the public health officials to speak to that.
And are you aware of any other cases of the Omicron variant in the United States at the moment, other than the Minnesota case and the California case?
We have been very transparent. Hopefully you would all agree about providing that information as it becomes available. It typically becomes through public health departments. They often provide it themselves first, but we are in close touch every single day with state and local public health authorities. So not that I'm aware of, obviously, it, again, typically rises through public health officials. I would note, as this Dr. Fauci has said over the course of the last week, every single day, even the restrictions we put in place was not going to prevent this variant from coming here. It would just slow. That was the objective. So we do anticipate there will be more cases, and we know that will be the case, and that's why we're focused on doing everything we can to fight the virus and the variant.
This big picture here, President Biden has repeatedly promised to shut down this virus. He has talked about wanting to end the pandemic. Is that still possible? Does he still believe that that is possible, or are we starting to shift now, especially with the rise of this variant, to perhaps accepting that we need to live with COVID for years to come?
Well, first I would say there's a lot we don't know about the variant yet, and that is challenging and frustrating. I understand for Americans, for all of you, and we want to give the space and time for the public health officials who are working 24/7 to assess and provide guidance on it. There are a range of options, as Dr. Fauci has spoken to and our medical experts have spoken to. It could be less deadly. It could be more. We don't know. So I just want to say that that is the next step in this process. The president, and you'll hear him speak to this today, continues to believe that if we build on the bold steps that we've taken to date, if we continue to make the vaccines more accessible, to increase testing, increase masking, we can return to a version of normal in this country. That's what everybody wants and everybody would like to see. Go ahead.
Back on the question about these reimbursements for rapid testing,
Yeah.
as anyone who's tried this knows, it can be kind of a cumbersome process. So why not just try and subsidize the price of these tests, as some of the other countries have done?
Well, first I would say that we're approaching it a little differently from some other countries. I know this isn't exactly what you asked, but we see the FDA process of reviewing and evaluating the efficacy and effectiveness of tests as the gold standard. That is a high bar in our view, and that's important to abide by that. Our medical team looked at a range of options. We want to make testing more available and more accessible to people across the country. There are 4 times more tests available now than there were in the summer. We will continue to build on that. So this is a step that was our team agreed was implementable and possible to do now, and we will continue to build on it.
On the issue of government funding, yesterday you said you were confident that we won't see a shutdown. We know the House is acting today, but a small group of Senate Republicans are still objecting. do you still have that same level of confidence today that we won't see a shutdown come tomorrow?
Well, the good news that I think you all saw today, and we just put out a SAP, or a Statement of Administration Policy, you know how we feel about acronyms around here, supporting the swift passage of H.R. 6119, which was basically a deal struck this morning. We still feel that there's time for lawmakers to set aside reckless and irresponsible political games and enact the short-term continuing resolution that would fund the government through early next year and allow for time for a full-year budget agreement, which is obviously our overarching objective. So there is still time to do that, and of course it's up to Congress to do that, but we are confident they will take steps to keep the government open.
There is still time, but not a lot of time. So have you started to take steps to prepare for a possible shutdown, even if it is, just one that lasts through the weekend?
Sure. So there are steps that are taken by the OMB, our budget team, that are standard. And they're not steps taken out of an assessment or evaluation of what's possible or the legislative possibilities. They typically start engaging with agencies about a week in advance of any scheduled timeline for government funding. They did that as of last Friday. They had another scheduled time to engage with agencies today. So that is standard operating procedure, and that's underway. But again, our objective is, of course, to prevent the government shutdown. We are, and of course, that's up to Congress to get done.
One quick immigration question. The administration announced today that the U.S. and Mexico have reached a deal to restart the Remain in Mexico program that was started under President Trump. This is something that your administration is fighting in court. The president, has railed against this policy. He's called it dangerous, inhumane, saying it goes against everything we stand for as a nation. Just wondering if you can reflect on how he feels about having now to see this move forward now.
Well, as you noted, Mary, Secretary Mayorkas also and the president have repeatedly said that this program has endemic flaws. It has imposed unjustifiable human costs, pulled resources and personnel away from other priority efforts, and failed to address the root causes of irregular migration. Deeply flawed. That's why we stopped enrolling individuals in the program on day one and subsequently issued a memorandum in June terminating the program. And Secretary Mayorkas issued another memorandum announcing and explaining his decision to terminate the program once again in October. As you noted, though, we are in a situation where we're under a court, abiding by court ruling. And so that is what we are working to implement at this point in time. There are some key changes and exemptions the Department of Homeland Security announced this morning and can speak to, but our view of the program has not changed. We're working to implement under the court order. Go ahead.
Thanks, Jen. Another testing question.
Sure.
So you said you want to make testing as affordable and available as possible. So in addition to requiring insurers to cover at-home tests, is the administration doing anything to make in-person PCR tests more widely available, more affordable? Because as anyone who has had to get a PCR test, let alone a rapid PCR test, knows it can be hard to find one and expensive, and especially getting that quick test is very, very hard.
Sure. Part of the plan the president is announcing is free tests, about 50 million tests that we're going to make available at places like rural clinics, community health centers, to ensure they're broadly available in a range of places where people can go and access them. And again, this is part of our effort to build on what we've already done to date. We made $3 billion worth of investments to accelerate the production of rapid tests and expand capacity. When President took office, there were 0 at-home tests available. Now there are 8. This supply will quadruple this month from where we were at in the summer, and we're going to continue to build on this. So this is a step to make it more affordable for people at home, but to also make them more widely available at a range of locations, community health centers, rural health clinics, so that people can go and find them.
And on abortion, based on what we heard at the Supreme Court yesterday, is the White House concerned that this Supreme Court is about to overturn Roe versus Wade? And what, if anything, are you doing to prepare for that possibility?
Well, I'm not going to make an assessment of how the Supreme Court will rule, but what I will say is that the president is committed to working with Congress to codify the constitutional right to safe and legal abortion as protected by Roe. He's announced his strong support for passage of the Women's Health Protection Act, urges Congress to pass it. And again, I would reiterate something I conveyed yesterday, that he believes that Mississippi's law blatantly violates women's constitutional rights to safe and legal abortion, Every American deserves access to health care, including reproductive health care. We're not going to predetermine how the Supreme Court will rule, but he supports codifying Roe through Congress. That's something that they can act to do.
You think that's a real possibility?
There is a bill currently, the Women's Health Protection Act, and he urges Congress to pass it.
Hey, I'm Rob Finnerty. Thanks for watching. If you enjoyed this video, please join the conversation in the comments below. Don't forget to subscribe, too. Hit the bell icon to be alerted to breaking news. And remember, there's a whole lot more on Newsmax TV, America's fastest growing cable news network. Newsmax TV, we're real news for real people.